If you talk to any paramedic about what their most feared call is, it's probably something to do with a child, just because of that lack of experience.
Pediatric medical emergencies make up just 1 to 3% of all cases for paramedics, very small. But despite that low number, there is a 31% error rate across all drugs administered to those kids by EMS. It's according to research from Western Michigan.
But now more than $1 million is going to research that aims to lower that error rate, supporting paramedics during times of crisis and better protecting kids. Our Janice Allen has a look.
This sounds a little science fiction, but think of the HoloLens almost like an Iron Man helmet.
Dr. Brian Harmer, professor of emergency medical services at Lansing Community College, channeling his inner superhero.
This is a Microsoft HoloLens 2. The device basically just goes on a person's head like this. It's got cameras on the outside of it. It automatically launches an application, and the cameras on the outside have the ability to read the environment.
Harmer and his partner, Dr. John Hoyle with Western Michigan, are hoping that much like Iron Man, their research will save kids.
My research focus throughout my entire career has been on pediatric medication errors that occur when children are cared for by paramedics.
Dr. Hoyle says pediatric emergencies are rare and they're hard to train for.
Critically ill pediatric patients are few and far between. Trying to replicate that, even with training, is very difficult.
Over the next 3 years, the team made up of researchers from Lansing Community College, WMU, and the University of Michigan will take the HoloLens and develop an app that will provide a checklist of steps aiding paramedics during moments of crisis.
We're going to take our simulation trailer and we'll run crews through 3 different simulated cases. We can use the functionality of the HoloLens and the cameras to actually look at the drug and confirm that, yes, this is the correct drug for the condition you've indicated, and hopefully even use it to confirm the dose that's in the syringe, which would be a major game changer.
And Dr. Hoyle says the lens will also be able to tell how much a child weighs.
One of the things that makes pediatric dosing so difficult is that, unlike with adults where there's standard doses, for children, it's all based on weight. So you have to do math or you have to have some kind of calculation every single time that you're giving a drug to a child. And doing that when you're under the most stress that you've ever been is exceptionally difficult and makes you more error prone.
And the hope is to someday translate this beyond emergency child care.
The first time that anything like this has been attempted with emergency medical services, and the time will tell, but we're hoping that this will be a true game changer.
And the team has received a $1.37 million grant from the U.S. Department of Health and Human Services to conduct their research.
The goal here is to have this application ready for distribution a few years down the road in 2027.